In our article, we discussed strategies for data and safety reporting and interpretation for pragmatic randomized clinical trials. We shared our viewpoints based on our experience with a variety of case studies. In this way, our article can provide practical guidelines and serve as a resource for the generalist conducting pragmatic randomized clinical trials. My name is David Zaria. I'm an assistant professor of biostatistics at Mayo Clinic. In collaboration with my co-authors, Ivana Krogan, John Inselman, and Sumitra Mandrakar, our article entitled Guidelines for Data and Safety Monitoring in Pragmatic Randomized Clinical Trials Using Case Studies will appear in Mayo Clinic Proceedings. Pragmatic randomized clinical trials have a unique set of considerations for data and safety monitoring. While there are published articles on the principles and procedures to help guide data and safety monitoring boards, or DSMBs, there are limited practical guidelines for generalists or medical general practitioners. Specifically, there is limited information available on which aspects of a trial to monitor and report during the conduct of a trial, how to interpret reports generated, and what the DSMB should focus on in their review of reports, including cautionary remarks with stopping the trial early for futility or effectiveness of these study interventions. To help address this gap in the literature, we provided 3 case studies based on our experience in implementing pragmatic randomized clinical trials. These 3 case studies incorporated design elements with varying degrees of pragmatism and illustrated our strategies for data and safety reporting and interpretation. With the growing internal expertise and experience in clinical trial design and conduct, with an emphasis on pragmatism or pragmatic features, the study investigators and DSMB members at Mayo Clinic are well positioned to successfully govern and provide the needed oversights for pragmatic randomized clinical trials. In contrast to explanatory randomized clinical trials, which aim to answer the question, can this intervention work under ideal conditions? Pragmatic randomized clinical trials seek to answer the question, does this intervention work under usual or real-world conditions? To provide evidence for adoption of an intervention into real-world clinical practice, pragmatic features in several domains are included in randomized clinical trials. Domains include eligibility, recruitment, trial setting, and organization, including how delivery of care is achieved by the participating sites, to name just a few. For example, increasing the extent that the study participants in the trial are similar to patients who would receive the intervention if it was part of usual care would be a pragmatic feature added to a randomized clinical trial. Increasing levels of pragmatism across these domains favor trial design choices that maximize the applicability of the trial results to the usual care setting. To our knowledge, there is limited information available on practical guidelines for generalists on what to monitor and report to the DSMB during the conduct of pragmatic randomized clinical trials, and what the DSMB should focus on in their review of reports. Our article discusses these matters in the context of 3 case studies focusing on a set of critical data and safety monitoring questions that would be of interest to the generalist conducting such trials. In considering these questions, we provided tabular and graphical illustrations on how data can be presented to the DSMB while drawing attention to those areas that the DSMB should focus on in their review of the trial. Wherever a randomized clinical trial is situated along the explanatory pragmatic continuum, the trial will involve study participants exposed to experimental interventions, and the trial may impact clinical practice. Therefore, the trial will likely necessitate review by a DSMB. The DSMB's role is to serve as an advisor to the research sponsor on whether to continue per protocol, modify, or terminate a trial based on periodic assessments of trial data. The DSMB will meet regularly to monitor accrual, data quality, safety, and efficacy outcomes, including protocol-specified interim analyses from the trial. DSMBs will face new challenges in terms of which aspects of a trial to monitor and when it is appropriate to intervene due to increased and varying degrees of pragmatism across multidimensional domains. The practical guidelines we provided in our article can serve as a resource for DSMBs governing pragmatic randomized clinical trials to help them focus on key elements of data and safety monitoring. In terms of what our next step is, first, it will be important to consider whether operational changes to our existing DSMB charters are needed to ensure that the specialized expertise that is called for to review trial conduct of a pragmatic randomized clinical trial is present. Additionally, it will be important to consider potential changes to our DSMB report templates to ensure appropriate review of pragmatic randomized clinical trials. Lastly, innovative solutions to facilitate the review of the trial data by the DSMB would be beneficial. A tool, for example, that performs extraction and linkage for obtaining trial outcomes can help facilitate the real-time assessments of data quality, reliability, and timeliness of data elements that oftentimes come from different data sources in pragmatic randomized clinical trials, such as from the EHR, from the clinic, and from other direct-to-patient methods. And because pragmatic randomized clinical trials support diverse enrollments, the use of such a tool could also guide real-time monitoring of enrollment to diverse populations. We hope you find the article useful. The article will be published in the November issue of Mayo Clinic Proceedings, and we invite you to read it for further details. Thank you.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.